Future healthcare systems educates doctors on how to help federal employees when they're injured at work. We're talking about postal employees, TSA, FEMA, Border Patrol, and all other federal agencies. When these federal workers get hurt at work, they struggle to find a doctor who knows how or is willing to treat them under the Department of Labor. We have nearly 3 million federal employees in this country, and I would be shocked if there are 300 doctors who are qualified and willing to help them when they're hurt at work. Most of the time, a federal employee gets hurt at work and ends up having to use their private health insurance to get treated because they can't find doctors who will help them. When this happens, they lose all of their federal work injury benefits, such as paid time off of work, paid time to get therapy, paid mileage, reimbursement of work-related healthcare expenses, using up their sick and vacation time to get treatment, and ultimately losing their schedule award benefits. Instead, they pay money out of their pockets for copays and deductibles. They have policy limits, and their health insurance limits the treatments they can receive that the doctor is paid for. Every year, nearly 100,000 federal work injury claims are filed. This doesn't take into account all of the federal workers who had to file on their private insurance. These claims aren't counted. So we don't know how many work injury claims are actually made each year, but it's well over the 100,000 reported. A federal workers' comp case can bring a doctor anywhere from $5,000 to $15,000 or more, depending on the severity of the injury and each doctor's individual treatment philosophy. And the DOL cares about its injured workers. DOL pays for all treatments that are medically indicated, based on the diagnosis and injury severity. There are no caps, no limitations, no timelines. The goal in DOL workers' comp is to get patients back to work in a condition where they won't get hurt again.